Welcome to This Explainer. Today, we're unpacking the incredibly stealthy realities of esophageal cancer. We'll be drawing directly on insights from a surgical specialist to break down exactly how this disease operates, how it's treated, and, most importantly, how to catch it. All right, let's just dive right in.
So do you turn red when you drink alcohol? It might seem like just a harmless, maybe even amusing quirk at a dinner party, but if you get a red face from just a little bit of alcohol, you really need to pay close attention to what we're going to explore today. That physical reaction, it's actually a vital clue about your internal health.
Section 1. The Stealthy Invader, Understanding the Esophagus and its Cancers.
Because cancers here grow so silently, it is absolutely vital to know what triggers them. Interestingly, the landscape of this disease in Japan is striking. Roughly 90% of cases are squamous cell carcinoma. Now, this type of cancer forms in the squamous cells. Those are the flat cells lining the innermost layer of your esophagus. Compare that to only 7% for adenocarcinoma, which develops in the mucus-secreting glands much deeper down.
And this points to a massive contrast when we compare these figures to the West. In Western countries, over 80% of esophageal cancer cases are actually adenocarcinoma. This Western prevalence is typically caused by stomach acid damage, often stemming from conditions like chronic acid reflux, which over time just severely damages the lower part of the esophagus. In Japan, however, that overwhelming majority is squamous cell carcinoma, which has a totally different set of triggers.
So the crucial point here is understanding what causes this predominant Japanese type. The primary culprits are really lifestyle factors, specifically smoking and drinking. And this is heavily compounded if you're a man in your 60s or 70s. Plus, it links right back to what we talked about earlier. Experiencing that red facial flushing when consuming alcohol is a major red flag. It indicates a much higher susceptibility to this specific type of cellular damage.
Section 2. The Closing Tube, the terrifying progression of symptoms.
Now, in its early stages, this cancer is completely silent. There are almost zero noticeable symptoms when it first begins to take root in that inner lining. But when symptoms do begin to pop up, they follow a pretty strict timeline. They often start as a really subtle discomfort while eating or drinking. You might feel a deep chest pain when swallowing, or a sudden stinging sensation in your chest, specifically when swallowing hot foods. And dangerously, these signs might temporarily disappear. It's a trap, honestly. That temporary relief tricks you into a false sense of security, leading so many people to delay seeing a doctor.
If ignored, well, picture your esophagus as a narrowing tube, gradually being blocked by a growing tumor. The progression is methodical, and it's terrifying. Step 1, solid foods start getting stuck. Step 2, you find yourself adapting because only soft foods will pass. Step 3, the blockage becomes so severe that you can't even swallow water. And finally, Step 4, it's completely blocked. You're unable to swallow even your own saliva, causing you to constantly spit or regurgitate.
As the cancer breaches the outer walls of the esophagus and begins spreading to surrounding tissues, the symptoms become systemic. It can invade the trachea or bronchial tubes. This advanced stage causes severe weight loss, simply because eating becomes impossible. You also see deep chest or back pain, chronic coughing, and even a hoarse voice as the local nerves get affected by the tumor's expansion. Section 3. Detection and Combat, How Doctors Find and Fight the Cancer.
Choosing the exact right diagnostic tool makes all the difference between catching it early and finding it way too late. Now, a standard barium swallow test, where you drink that chalky liquid that lights up on x-rays, is very common, but it focuses mainly on the stomach, and the liquid moves quickly, which means it frequently misses early esophageal cancer. On the other hand, an endoscopy is the absolute hero of early detection. By sending a tiny camera directly into the esophagus, doctors can meticulously inspect the lining and spot the danger directly, even when it's just barely beginning.
Once cancer is spotted and confirmed via tissue biopsy from that endoscopy, a CT scan becomes the next most vital tool. A CT scan uses advanced X-ray techniques to create detailed, cross-sectional images of your internal organs. It's totally essential to determine the disease's stage, specifically to see if the cancer is spread beyond the esophagus into the lymph nodes, lungs, or liver.
Okay, now for the treatments. If caught very early, meaning the cancer is strictly confined to the superficial mucosa lining of the esophagus, doctors can perform an endoscopic resection. This is incredible, really. Using the endoscope, they literally carve the cancer out from the inside of the tube, entirely saving the patient from major, invasive surgery while fully preserving the esophagus.
For more advanced stages, however, surgical resection is required. Surgeons actually have to remove the affected part of the esophagus and pull up the stomach or intestines to reconstruct the digestive tract. Looking at the data, we have to impartially note that this carries some serious complication risks. We're talking suture leakage, severe pneumonia, a permanently hoarse voice, and even potential failure of the liver, kidneys, or heart. Currently, this intense procedure carries a 2 to 3% mortality rate, which poses an especially high risk for elderly patients.
Because of those risks, surgery is often preceded by chemotherapy. The goal here is to shrink the tumor and reduce the chances of recurrence. To achieve this, there are two main types of drugs used. First, you have cytotoxic drugs, which directly attack and interfere with the cancer cell's ability to multiply. Second are immune checkpoint inhibitors. These are fascinating. They don't attack the cancer directly, but rather remove the brakes from your own immune system. This keeps its fighting power active so your body can attack the cancer itself.
For patients who are physically unable or who simply choose not to undergo initial surgery, a combination of chemical and radiation therapy is used to try and cure the disease. But if the cancer survives this treatment, or if it comes back, doctors might attempt a salvage surgery. This is a final rescue measure. It is exceptionally high risk, much more so than standard surgery, and requires very careful, informed consent from the patient and their family.
Section 4. Taking action, prevention, and proactive screening. The ultimate goal, of course, is catching this in that completely silent phase before it grows. The basics of prevention pretty much mirror general cancer rules. Quit smoking immediately, keep your alcohol intake moderate, exercise, and maintain a balanced diet. But here is a highly actionable tip from the source data. During your routine health checkups, especially in Japan where stomach screenings are very common, specifically ask your doctors to check your esophagus. Since standard screenings sometimes glaze over the esophagus to focus on the stomach, advocating for yourself is absolutely vital.
But really, the crucial point to take away from this entire explainer is identifying the highest risk demographic. If you are a man in your 60s or 70s and you experience facial flushing when consuming alcohol, you are at the absolute peak of the risk curve for squamous cell carcinoma of the esophagus. Even if you feel perfectly fine, you are the prime candidate for proactive screening.
So I leave you with this final thought. Have you felt even a passing discomfort when swallowing hot foods, or do you fall into that high-risk alcohol flushing group we just discussed? If so, please do not wait for the symptoms to disappear, and definitely don't wait for the tube to narrow. Will you take control of your health and request an endoscopy at your very next checkup? Remember, knowledge is only power if you act on it. Thanks for joining me on this explainer, and stay proactive about your health.